Welcome to this video lecture on the Unit 42 of our course Sociology of Health and Illness. In this unit, we will discuss about the role of social workers working with persons with disability. Social workers who work with persons with disability has a lot of responsibility. Social worker support the person with disability for complete diagnosis of his or her issues and help them to cope life with that disability. Social workers also help the person with disability to live a safe and stable life. They work for the empowerment and suitable employment of the person with disability. In any time of crisis or emergency situation, social workers are also seen extending a supporting hand to the family with a child or adult with disability. They stand for them as the safeguard but maintain professional relationship and play a role as a guide and advocate. Social workers help scientifically bring about expected changes in the person, family, and the society at large. So let us discuss about the role of social workers in this context in detail. First is awareness creation about disability. The biggest problem faced by the person with disability is to deal with other people. Awareness creation about disability means to provide education and knowledge to people about disability. It is important to focus that any kind of discrimination towards PWD is against law. According to the World Bank report, there are about 1 billion people or 15% of the world population are experiencing different types of disability across the world. In the field of education, health, social economy, employment, and justice, they have been suffering from discrimination. Research has found that the most effective and powerful initiative is to educate the school children. Children are the future citizens of the country. Therefore, if disability awareness could be generated among the school students, it would be extremely beneficial for future society. In the school period of life, a student could develop empathy, positive attitude in one's own personality. If one gets exposed to awareness programs about disability. In addition, classroom is such a platform for a student that allows them to learn about their peers and how to accept others. And social workers or counselors can help the school students in this process. But apart from school, learning begins at home. The most comforting and safest place for everyone is one's own home, where we develop an understanding towards every aspect of our life. Home is that basic platform for everyone where we can learn about positive attitude, values, and custom. If a child learns about love, humanity, and gain awareness about disability at an early stage of life, it would be extremely useful for his or her future and also for the society at large. Therefore, teaching a child about the importance of being empathetic towards a person with disability involves socializing children about empathy and acceptance of diverse people to build a barrier-free society. Then comes sensitization about disability. Sensitization means knowing that pain exists and there is a different way of living, and despite how the person lives, he or she has a right to exist in the society. It's a attitudinal change. Research has found that in India there is about 75% school-going children, most of them between 10 years to 19 years of age, who has some kind of special need and they leave school early. Lack of community sensitization among parents and teachers of primary school is a results in social barrier. When a person has some kind of disability, he or she has to face different situations and emotions in their life. It is not only physical or mental in nature. Therefore, instead of sympathy, use of a sensitive approach by the government, school, parents can bring about awareness programs and other workshop, special training with the help of counselors working in this domain can help to break the social barriers, which will be very effective for removing discrimination among all the people of the future generation. Another important task of the social workers in this domain is counseling the persons with disability. Counseling is a talking therapy which can be life enhancing, promoting positive change, etc. Rehabilitation counselor has professional knowledge about disability to offer a deep understanding of issues related to disability. When a rehabilitation counselor works with an individual with disability, he or she should be aware and be sensitive about some of the important things. The counselor should be, first of all, be very careful of the use of language, because words are very powerful, which can make or break a person's inner strength. A simple word and its use can motivate or disappoint someone. Rehabilitation counselor should be aware about the perception of the individual and his/her family towards disability and their social and historical belief system. Training of the rehabilitation counselor is therefore very much important in this area to understand the experience and the process of disability. A rehabilitation counselor should be mindful of some of the things which will increase their effectiveness in building a therapeutic relationship with a person with disability. Let us know about those aspects. First of all, a counselor should consider the effects of the labels that may have on a client. For example, calling a person with disability as a patient every time rather than by his or her name can have a negative impact on that person. A counselor must be also aware of his or her own attitudes and biases which can affect the counseling process. A counselor must also develop an understanding about how the client describes. A counselor must also identify the topics that makes the person concerned uncomfortable, for example sexuality, so that the counselor can address that issue. A counselor should also try to maintain an open mind so that the person with disability can share experiences within that professional relationship of counseling. Apart from counseling the person with disability, it is also necessary to counsel the families with PWD. Now let us try to know why it is important to counsel the family of the members of PWD. The rehabilitation counseling guidance to the family members is essential because the family members of the person with disability can have immense impact to motivate their loved one. The family or the caregivers play a vital role to recover the person after injury, illness or disability. Family members' positive attitude and reinforcement can build the person's self-esteem, and counseling can help the members to learn new coping mechanisms with this new responsibility. When a member of the family has some physical or psychological challenge, other members too experience feeling of isolation, loneliness, burden, depression, and anxiety, which may lead to emotional or physical health problem. Therefore, rehabilitation counselor has an important role to help the members of the family with the person with disability to overcome their stress. So providing rehabilitation counseling guidance to the family members of the person with disability could help them to make them feel less lonely. It can help them to interact with society in a safe environment. It can help them to improve the coping skills and empower them. It can help the family to gain information about the opportunity of treatment option for the person with disability, and it can make the counseling process effective in coordinating with multidisciplinary process. To make the counseling process effective, coordination with multidisciplinary professional is necessary. Coordination with multidisciplinary professional is an effective and efficient mechanism for rehabilitation profession. It is important that a team works together to achieve the goals determined with respect to the person with disability. The multidisciplinary team who works for the rehabilitation is a team of professionals including representatives from diverse fields. Coordination among the entire team of rehabilitation and generating awareness about the role of each and every member is important to achieve the expected goal. During a rehabilitation multidisciplinary counseling, the following members may be involved. First is the person with disability and their family. The second is a psychiatrist. The psychiatrist is often the team leader. They are responsible for coordinating the patient's care services with other professionals. Psychiatrists give importance on restoring function to the person with disability. Then comes the rehabilitation nurse, a nurse who specializes in the rehabilitative care and helps the person to reach the highest level of rehabilitation. Rehabilitation nurse works for medical care, prevention of complications, and education of family and patient. Rehabilitation nurses also assist the patients in their movement towards independence by setting some realistic goals and treatment plans. Then comes the clinical social worker. The clinical social worker helps the person for better coordination with the rehabilitation team and prepares them for discharge planning and referrals. They also work for insurance facilities between the company and the client. We also have a physiotherapist. A physiotherapist helps to restore function for people with problems related to movement, muscle strength, exercise, and joint function. Then comes an occupational therapist. An occupational therapist helps the people to restore functional activities which are related to their daily life activities. We also have a speech therapist. When a person has an issue with communication, thinking, or swallowing, a speech therapist can help that person restore those functions. Then comes a psychologist. A psychologist or a neuropsychologist does the cognitive assessment of the person. They also teach the family and the person how to live with disability. In the multidisciplinary team, there is also a recreation therapist. Social skills and free time activities can help build a person's creativity, which a recreation therapist can restore. Then comes the audiologist. The task of an audiologist is to examine the hearing and the hearing loss. The team also consists of a registered dietitian. According to the medical needs, eating abilities and food preferences of a person, dietitian evaluates and suggests for diet when a person is undergoing rehabilitation treatment. Then comes the vocational therapist. Vocational therapists or a counselor provides the information about suitable job placement according to the ability of the person. A vocational therapist provides guidance and career support to the PWDs. Coordination with multidisciplinary rehabilitation professionals and collaborative efforts reduce cost and improve the patient's outcome. Social workers in this domain are also helping in the formation of PWD association, advocacy and networking. Around the world, people with disabilities have organized association with the slogan "Nothing about us without us" as advocates for their own rights by them, for them and of them to influence decision makers in government and other sectors of society. According to their needs, opportunity and context, people with disabilities unite to form different organizations. These organizations are intended to promote their rights to participate equally among all in society by empowering themselves instead of being controlled by others. Before this, PWDs were controlled by health professionals, family, and others for their needs, choice, and priorities. As everybody can feel their own emotions, needs, or problems better than others, therefore, PWD organizations work as the representative of their own. Throughout the world, most of the PWD organizations has been formed in big cities of the countries at the regional and the national levels, but does not exist at the grassroots level. However, there are exceptions including Bangladesh, El Salvador, South Africa and Uganda. It is very important to have representation from the grassroots level to strengthen these organizations. In many countries, there are also networks of PWD organizations. Example, the Federation of Persons with Disability in Burundi, the World Federation of Deaf, the World Blind Union, Disabled Peoples International. Many of these have joined together to form an international network known as the International Disability Alliance. In a PWD organization, people with disability help themselves to form their own leadership, but community-based rehabilitation organizations are most helpful for empowering them through the support of other stakeholders in the community. With the representation of all the types of disability, including women and children with disability, organized an association with the interested person. The social workers through these organizations give information about the benefits of forming PWD organization, organize training workshop for capacity building of the member of PWD organization at the national or regional level. They also provide them to develop their mission, objective, plan of action, organize structure, register with local authorities, and help them in opening bank accounts. They also invite local members for training sessions organized by the CBR to show them how the local leaders are aligned to the disability issues. So as we have mentioned earlier, social workers are also involved in advocacy and networking. In India, almost 3,000 organizations, government and non-government, work for the rehabilitation and empowerment of PWD with the objective to promote local advocacy and build leadership among them. However, these organizations work for the empowerment of PWD to protect their human rights, including their family, friends, etc. It is worth mentioning that disability has been considered as a welfare issue in India and not a development issue. The National Center for Promotion of Employment for Disabled People is a national disability network. The Cross Disability non-profit organization also works with a range of stakeholders to disseminate information and knowledge, advocate for the rights of PWD, and increase awareness in India. Now, advocacy means helping a person or supporting a person as his or her voice and ask for the rights with understanding the need of the person. Social workers also get involved in group advocacy. It helps the people with disability to raise their own voice to achieve their rights and help them to work in unison with government officials, media, funding organizations, and help them as motivating volunteers. So dear learners, In this unit, we have discussed about the role of social workers working with the persons with disability. Hope you all have understood it. Thank you.